Many congratulations on the arrival of your new baby. This video is here to give you important information regarding your recovery, caring for your baby, and where you can find helpful resources. You will be supported by midwives and maternity support workers for up to 4 weeks. They will offer advice and health checks, including weighing your baby, jaundice screening, and the newborn blood spot screening test. If your baby is staying for extra medical care, you will have your appointments at the hospital. Otherwise, your community midwife will visit you the day after you go home. If you haven't been contacted by 4 p.m, please call us on 01223 217 667. Adjusting to life at home with a new baby can be overwhelming, and it helps to know what to expect and how to care for yourself. In the first days, mild labour-type pains are normal. This is the womb shrinking back to its pre-pregnancy size. You may experience other common symptoms like perineal bruising and discomfort, tiredness, back pain, muscle aches, constipation, bladder weakness, night sweats, or hair loss. Most symptoms resolve by 4 to 6 weeks, but if they don't, talk to your GP about it at your 6-week check. Regular pain relief will help. Most people are advised to take paracetamol and ibuprofen for the first 1 to 2 weeks, longer if you've had a cesarean. Don't hesitate to speak with your midwife about this. If you have perineal stitches, there are simple measures to help you heal and avoid infection. These include changing your pads regularly and washing your hands before and after, and showering or washing daily using just water or a non-perfumed pH-neutral soap, but be careful not to soak the stitches. If you are worried or feel something isn't right, ask your midwife or GP to take a look at your stitches. If you had a cesarean birth, the incision can take up to 6 weeks to heal. Cleanse it daily with just water, pat dry gently, and ideally remove clothing for some of the day to air the wound. It's important to avoid strenuous exercise or lifting anything heavier than your baby. And if you drive, check with your insurance provider when you can drive again. However you gave birth, it is normal to lose blood afterwards. You may need to change your pad every 2 to 3 hours for the first few days. Bleeding can be heavier when you get up after lying or sitting down, or after feeding your baby. If you feel unwell, experience abnormal blood loss, such as soaking a pad in less than an hour, passing multiple clots, or a clot bigger than a golf ball, or the blood having a foul smell, call our assessment line on 01223 217 217. Please also call this line if you display signs of mastitis, like a painful swollen area that feels hot to touch on your breast or chest, or a change of colour or red area on your skin. In some situations, you may need to see a doctor urgently, or consider calling 999 for an ambulance. These include sudden or excessive blood loss, like a tap being turned on, a high fever, severe abdominal pain, loss of consciousness, a fast heart rate, chest pain, shortness of breath, widespread rash, a red or darker coloured swollen and painful leg, a severe headache with visual disturbances or vomiting. No matter how you gave birth, it's important to start pelvic floor exercises as soon as you feel able to. It helps to reduce perineal swelling or pain and prevents long-term incontinence. If you aren't sure how to do these exercises, you can ask your midwife. They can also signpost you to tutorial videos. Some gentle activity alone or with your baby, especially a walk outside, can help your physical recovery and your mental health. You will also benefit from a well-balanced diet that includes iron-rich foods. Speak to your midwife about vitamin D supplementation, as they can advise if you need to take this. We know that making time to care for yourself isn't easy. If possible, ask friends and family to help with things like doing the shopping, bringing you a home-cooked meal, or watching the baby while you shower. If you don't have local support, talk to your midwife about ways to cope. As your body and mind are recovering after birth, it is important to wait until both you and your partner feel ready and comfortable before being physically intimate or having sex again. You can become pregnant as soon as 3 weeks after birth, even if your period hasn't restarted and however you are feeding your baby. You can discuss your contraception options with your midwife or GP. Having a baby causes hormonal and chemical changes in the body, which can make you feel unexpected emotions. This is often called the baby blues. It is common to experience difficult thoughts and feel anxious, tearful, or irritable, but this should improve within 2 to 4 weeks. If you have extreme feelings of despair, worry, or thoughts of self-harm, or low or negative feelings that continue beyond the first couple of weeks, or start out of the blue, it may mean that you suffer from postnatal depression, postnatal anxiety, or a post-traumatic response. Partners can experience this too. This isn't uncommon, and there is help and treatment available. Speak to your GP, midwife, or health visitor, or self-refer online to Cambridgeshire and Peterborough Talking Therapies. If you or someone you know urgently needs to speak to a mental health professional, simply phone 111 option 2. Unfortunately, having a new baby is a time when relationship difficulties can start or get worse. The same can be true with domestic abuse. If you have any worries about your relationship, whether you feel at risk of harm or not, please talk to your midwife, GP, or health visitor. Personalised help is available. You are not alone. You can also contact the National Domestic Abuse Helpline on 0808 2000 247. It takes time for new parents to get to know their baby, but there are things that can help. Skin-to-skin contact, face-to-face interactions, and cuddles help you and your baby to get to know one another. It calms your baby, making them feel safe and helping their brain development. It's normal for babies to cry, and as you get to know them, you will understand what their different cries mean. It can be frustrating at times, but never shake your baby. If you are struggling, the icon leaflet in your postnatal pack has advice on how to cope. Sudden unexplained infant death, also known as cot death, is rare, but there are some simple steps you can take to significantly reduce the risk of it happening. Always place your baby flat on their back for sleep, with their feet at the bottom of the Moses basket or cot, so they can't wiggle under the blankets. Make sure the mattress is flat and clear of any toys, pillows, or bumpers, and tuck in loose bedding. The room temperature should be between 16 and 20 degrees. Your baby should be in the same room as an adult for all sleep, day and night, for at least the first 6 months of life. If you are planning to co-sleep, or think this might happen, make sure it is on a firm, flat mattress. Keep pillows and adult bedding away from your baby, and make sure they can't get trapped or roll off. It's also important to make sure older children and bed partners who may sleep more heavily or be unaware of a baby in the bed do not sleep alongside the baby. There are situations when co-sleeping increases the risk of cot death. This includes if anyone in the bed smokes, has drunk alcohol, or taken drugs or medications that make them sleepy, or if your baby was born before 37 weeks or weighed less than 2.5 kilograms at birth. To keep your baby safe, never sleep with them on a sofa or leave them alone with a pet. Do not allow people to smoke around your baby. If you or your partner and family want help to quit smoking, our smoke-free pregnancy team can support you, or you can visit nhs.uk/smoke-free. There are some important signs and symptoms that require emergency care. See a doctor urgently, or consider calling 999 if your baby is floppy, can't be woken up, is not breathing normally, has a fit, has changes to the colour of their lips or mouth, has signs of infection. Signs of infection include a low or high temperature, no interest in feeding, not passing urine, vomiting green fluid, a rash that does not fade when pressed with a glass. You also need to take your baby to a doctor or speak to a midwife urgently if they have blood in their nappy or poo, haven't had a wee or poo in the first 24 hours, or are visibly yellow in the whites of the eye, gums, or skin in the first 24 hours. It might take time for you to feel confident with recognising feeding cues and feeding your baby, but local support is available. Feeding encourages bonding and soothes your baby. Once they are a day old, your baby should feed at least 8 times over 24 hours. Most newborn babies will cluster feed day or night. This means lots of feeds over a few hours, and this is normal. Signs that your baby is feeding well include baby settles well after the feed, weight loss is under 10% in the first 5 days, and frequent wet and dirty nappies. By day 5, your baby should have at least 5 wet nappies a day and 2 dirty nappies that are yellow and slightly watery. You can top and tail wash your baby to keep their face and nappy area clean. Once they are a week old, you can bathe them in water no hotter than 37 degrees. Please avoid using cleansers and soaps. It's best to leave the umbilical cord stump alone, but if it needs cleaning, gently wipe it with plain water. It will usually fall off within 2 weeks. It is normal for it to smell and look unpleasant, but if the skin around it is red or inflamed, contact your GP. When going home with your baby in a car, use a rear-facing car seat and turn off the airbag. It is safest for your baby to travel in the rear of the car. Remove bulky clothing so that the straps fit securely. Babies should not be kept in a car seat for more than 2 hours. They are only for transport. So once you arrive at your destination, always take your baby out of the car seat, even if they're asleep. We hope you had a positive birth experience, but if you didn't, we want to support you with this, and your feedback is important to us. Speak to your midwife today or at home. You can also access a birth reflection service and the Rosie Maternity and Neonatal Voices parent-led group. Thank you for watching. We hope you found this video helpful. For further support, information and advice, please scan the QR code or visit the link below.